Hello, and welcome to this talk, Shut Up, Quarantine and Social Distancing During Tudor Epidemics. I'm Dr. Euan Roger, one of the principal record specialists in the medieval team, and I'm going to be looking today at the first instance of quarantine measures in England in 1517 to 18, looking at how these measures worked and how they were received. And I'm going to split this talk roughly into three sections. So firstly, what was the situation in England at the start of the 16th century, and why might we see a change in this period? Then I'm going to talk about the practicalities of the quarantine measures which were brought in across England in 1517 to 18, and finally I'm going to look at some of the potential problems with the measures and how they were received. When we think of plague in England, two major epidemics come to mind, the Black Death of 1348 to 9 and the Great Plague of 1665 to 6, two outbreaks among the centuries-long Second Plague pandemic caused by the bacterium Yersinia pestis. These were events of mass mortality and shocked the country, so why am I instead focusing on the 16th century here? Well, the plague didn't go away in between these events. It became endemic in England, arriving almost every year with greater or lesser mortality rates. Outbreaks might be local one year or might cover the length of the country in the next, and in the absence of a cure, individuals and state officials had to try and find ways to manage outbreaks as best they could over a long period of time. And at the same time, pauses in the spread of death and infection between small-scale outbreaks, unlike the mass mortality of 1348 to 9, for example, allowed these individuals to give greater thought to the measures put in place and to consider more ambitious schemes and models, which could be altered according to the needs of each outbreak. It's one of these measures that I'm going to be talking about today. So what sorts of measures did individuals and the state have at their disposal prior to the 16th century? I'm now going to show you two examples of earlier state measures from the Black Death in 1349 and a later private document which ended up in our collections. Believing that infection was caused by miasmatic air, essentially foul air which could contaminate clothing as well as poisoning an environment, one of the main measures which civic officials in particular could implement were programs of customary regulation and sanitary measures to keep towns and cities clean, and thereby attempting to avoid miasmatic air. The first of these documents, a letter from Edward III to the civic officials in London, gives us an idea about the type of sanitary measures which could be enforced by government, although towns and cities generally had their own historic measures in place called customary regulations. The letter here asks that all streets be cleaned of faeces, human and otherwise, and other filth as the air is infected and the city poisoned. And if you're interested in these sorts of measures, I would definitely recommend the book Urban Bodies by Professor Carol Rawcliffe to find out more. The second means of state measures shown here is to identify those who have died from infection, particularly in jails. Although there really isn't much evidence to show that anything was done about this, it's more to do with proving that people didn't die of violent deaths. And the second document here shows the record of a prisoner from York who had died from the pestilence at Coppergate. My third image shows a private recipe for a medicine against the pestilence, which is using herbs and flowers amongst other ingredients. Now, generally, these would have been used in the home, probably to get rid of symptoms rather than necessarily curing the disease, and there's very little evidence from the Black Death to show them being particularly effective. But this is the kind of recipe that would have been used. Now, I should note that we're missing one key response to infection here, which is prayer. I haven't included it as I'm going to be talking largely about state measures today and about practical measures. So I think we need to bear in mind that whichever practical method of trying to avoid infection might be opted for by communities and individuals, prayer and religious belief would have been an important factor in all of these cases as well. So these are just some of the measures which could be taken, but if you could afford it, the best action was to try and avoid infection through mobility, leaving cramped and infected cities for the countryside where possible and avoiding infected areas. And by the 16th century, this was kind of the go-to means of avoiding the plague, as well as the other infectious diseases such as the pox, measles and sweating sickness, an unidentified disease which appeared out of nowhere at the end of the 15th century and often went hand in hand with outbreaks of the Great Pestilence. And it's important to note that mobility, you don't have to go too far necessarily to avoid infection. So there are examples from Eton College in the kind of start of the 16th century of people moving about 4 or 5 miles down the road. So the Eton College schoolboys go to Langley in nearby Slough, and at St George's College in Windsor they go to Bray, so again about 5 miles down the road, not very far at all. It's just avoiding those centres of infection really. So in the context of this, what prompted changes in policy in 1517? There are clearly measures in place already that either the state or individuals can take against the spread of infection. Why change in 1517? Well, the epidemic that year was noted as being particularly cruel and wide-ranging, reaching almost over the entirety of England and as far north as the Scottish border, and running right the way through for much of 1518 as well. Now, rather than being the start of an ambitious new social policy led by the King's chief minister, Cardinal Thomas Wolsey, I suggest that these are actually more to do with sorting out Henry VIII's own personal fears. He seems to have been particularly alert and nervous about the spread of plague and contagious disease, more so than the general populace, and particularly in times of national outbreak, exacerbated by the introduction of the new sweating sickness. And at this point, the royal court is moving around the countryside frequently, often stopping for only short periods of time before departing to the next palace. This increased mobility is intended to keep the court, and the king in particular, distant from infected places and away from the capital where disease could spread quickly in the crowded streets. But on occasion, even increased mobility of the household was not enough for Henry. In August 1517, for example, he was recorded as having dismissed the entire court, both his own and the Queen's, as the plague had made great ravages in his household, and only a small contingent of 4 favoured gentlemen remained with the King and Queen, who would remain absent from London. Now, obviously, some of these fears are natural. Any fears of infectious disease are natural. And in particular, in both November 1517 and March 1518, Henry VIII is waking up to find 2 dead page boys in his chamber on each occasion. So that would worry anyone. But his fears are definitely felt by his contemporaries to be over-exaggerated. Now, the Venetian accounts, at which the National Archives hold 19th century transcripts, provide an insight into life into London during the various disease years of 1517 to 18, and the constant concern over disease during his first decade as king. These are the accounts of the Venetian ambassadors, which are held in Venice, but we have these transcripts. And the ambassador himself at this time is making constant requests to his native Venice for a replacement to be sent out to England. In November 1517, he wrote that he considered it high time to escape from sedition, sweat and plague. While in July 1518, he complained that 2 of his servants had lately died from the plague, while the ambassador himself had previously suffered from sweating sickness twice in 1 week. And in previous years, the previous ambassador's servants had also died of infectious disease. In August 1513, it was recorded that 2 servants sickened on the 22nd, but did not die immediately. Instead, on the 28th, they rose from bed, went to a tavern to drink a certain beverage called ale, and died the same day. Now, whether this was a result of infectious disease or the standard of London's ale at the time remains a question for another day. So why have I digressed into talking about the Venetians, besides warning of the dangers of London's ales? Well, the answer is they give a useful insight not only into general personal worries about the plague, but specifically those of Henry VIII, or at least the gossip that was heard around court. Besides the sending away of the rest of the court, which I've mentioned previously, the Venetian accounts also wrote that the King and Wolsey were absent from London from dread of infection, despite there being a general state of discontent caused by the protracted absence of the court from London, the outbreak being described by those in the capital as somewhat abated. And you sense the ambassador becoming very frustrated throughout this, stating regularly that he was unable to get audiences, either of the king or of Wolsey. But most notable of all this Venetian gossip, however, is a letter dated 26 July 1511, which gives a very personal motive for Henry to fear the plague. It states that the Queen Widow, mother of the late King Edward, had died of plague, and the king was troubled. Now this can only refer to Henry's grandmother, Elizabeth Woodville, mother of King Edward V and Queen Widow to Edward IV, whose funeral accounts provide further evidence for death by infection. Essentially, she's buried at Windsor, but the community take great care to get her body buried as soon as possible, and then they hold the ceremonies as usual without the body present. So this is very much a historical concern and fear, rather than saying she died in 1511. She'd actually died in 1492 in Bermondsey Abbey, where she'd taken refuge after Edward IV's death, but it's clear that even some 20 years later, Henry still fears this disease that had taken his grandmother's life. So you can kind of get this impression of him talking about his grandmother at court and these fears being picked up by the ambassador. You get this impression that he's thinking historically about his family and about disease, and in the absence of an heir, about his legacy. I think the point here is that he's aware that infection can strike anyone, no matter your status, and I think he's very much aware that his position as king does not make him immune. And these fears were probably exacerbated in 1511 by the death of his firstborn son, Prince Henry, who sadly dies only a month after his birth, the causes of which are unknown. Now, just to say, because of time, I'm not going to go too much further into this Woodville question today, but this is something we can pick up in the Q&A if people are interested. And you can also read more about my arguments for this in the article I wrote on this for the journal Social History of Medicine, which Oxford University Press have kindly made freely accessible for anyone listening to this webinar for the next 3 months. Returning to Henry VIII's extended absence from court, I should be clear that the court moving around from place to place was not new, both in times of disease, where mobility was required, but also in normal times when the court would often go on rural progress around the country. What's different here, however, is the uncertainty felt about Henry's movements, a nightmare for those attempting to prepare for his movements and to provide provisions. These fears of uncertainty are particularly obvious in this letter from March 1518, where the king was clearly changing his mind regularly and provisions had run low, pure necessity requiring a return to London that Henry was unwilling to take, stalling instead and trying to find a palace near London without the threat of infection. So I'll just read out some of these quotes. There is some doubt whether the King's Grace will return towards London or no. The Lord Steward has no knowledge why the King's mind should be changed. Pure necessity must compel the King to depart hence towards London, for here we cannot abide. And at Woodstock is no manner of horse meat. So I should note here that the reference to horse meat doesn't mean they were eating horses. Rather, it's a word which means food for horses, and also is kind of used as a shorthand for general supplies. And then this final quote, the King's Highness is desirous to be advertised by your Grace hastily, whether any of his palaces near unto London be infected with the sickness or no, or any place near unto them. So he's trying to find out if there's anywhere he can go where he might be safe. One interesting question is whether dissatisfaction about Henry's absence from London may have manifested itself on the official records of the time. So these are images of the plea rolls of the Court of King's Bench, the highest law court in England. And throughout Henry's reign and beyond, they depict the monarch presiding over his or her court. So the idea is here, in the first days of the court, the king would have sat in judgment over the court, which is why it's called King's Bench. By this point, that the kings don't really do that anymore. So instead you have this image of the king overseeing the records of that court. And actually Edward IV tries to take up tries to exercise his right to sit in judgment and kind of causes upheaval in the court because he's not meant to be there, and they get very confused. So these records are produced with a woodcut, and you can see on the left-hand image, this is the king on his throne, looking very different, I think, to how we normally think of Henry VIII in his kind of older years. He looks very young here, very early in his reign still. And for the rolls up to Michaelmas term 1517, we see Henry on his throne. But for the 2 terms at the start of 1518, he suddenly vanishes to be replaced by the Royal Arms instead, before returning in Trinity term 1518. So he kind of vanishes at that time where we know he's physically away from the court, and comes back in the summer of 1518 when the infection is kind of abating a little bit. So is this a comment by the clerks producing the rolls, who are known to add satirical or political commentary sometimes, or have they just lost the woodcut block during the disruption around the movement of the court? So we know at this point the court, and the same with Parliament, they have to move around to avoid infection, they get postponed. So they may have just lost the woodcut block, but for me it feels very deliberate that at this time he suddenly vanishes. The king's concerns continued to grow through April 1518, becoming increasingly acute as the cold weather of winter was replaced by unusually early warm weather. On the 6th of April, Henry summoned his council at Abingdon to inform them once again of London's infection, an infection which Henry claimed had been kept secret from both Wolsey and himself. So I'm just going to read you out part of the text of this letter now. Please at your grace, the King's Highness has commended me to certify your grace that this day he has called all his council unto him, and showed unto the same that both his Highness and the Queen's Grace have been credibly informed that his Grace's city of London is somewhat infected with the great sickness. And though the said infection be not great, but dropping here and there, yet his Grace does think it right necessary that for the safeguard of his person, whereupon the wealth of this realm does depend, he should eschew the same. And his grace does think that such infection is kept from your grace's knowledge, as it was from his being there oftentimes, because no man does certify his grace thereof. So that where his highness is very desirous his mind to repair towards London, he is compelled by necessity to remain in these parts at such places as be comprised in a bill here enclosed, for avoiding of the said sickness, for it shall be to his grace's pain, considering the scarceness of the country here. So this is Henry saying that he wants to go back to London. He realises that there's not provisions for him where he's staying, but he's worried that the Londoners are keeping signs of infection to themselves. And it's quite possible that they were, because on one hand, the Londoners don't want their kind of wealthy merchants heading off into the countryside. They want the king to be there. They want business to be able to be done. They don't want everyone disappearing because of the threat of infection. And this is something we'll come back to in a little bit, but it's just worth pointing out here. Henry's kind of almost paranoia, but actually there might be something to it at this point. As a consequence, Henry chose to stay clear of London once again, despite plans already being in place to travel to the capital. 2 days earlier, on the 4th of April, Henry had stated his intention to return to London if not compelled by the sickness to leave, but clearly had changed his mind upon hearing rumours of such infection. Instead, he left Wolsey to take care of business in London, with a train of horses set in place every 7 hours to convey messages between the two. So business isn't being completely abandoned, it's just slowing down from what it would normally be. And I do feel rather sorry for Wolsey at this point, as he gets sick regularly. On the 12th of August 1517, for example, it was noticed that he himself had suffered the sweating sickness 3 times in only a few days, during which time most of his attendants and his gentlemen had died. Royal fear of the London infection, however, was not limited to the king. Queen Catherine claimed that she had knowledge that some sickness was in London, for which, though she be no prophet, yet she would lose her finger if some inconvenience should not ensue unto the king's person if he should at this time repair into London. On the following day, the council felt compelled to inform Wolsey that Henry's unwillingness to travel to London was his own decision, on account of the king being afraid of the sickness, and that he was quite comfortable in Abingdon. And this quote's really poignant, where no man cometh tell him of the death of any person, as they were wont daily to do in those parts. So he doesn't want these people coming and telling another person has died, another person has died. And a few days later, on the 12th of April 1518, the reasons for the king's about-face become very clear, it being reported to Wolsey that it's secretly spoken here that the Queen's grace is with child. And the reporter of that statement prays it would be a prince to comfort the realm. That this revelation immediately follows inquiries about the spread of infection is absolutely no coincidence. Henry's personal fears of infection and disease are intrinsically linked to fears for his family and his lack of an heir, and when the Queen was pregnant, those fears were further heightened. Okay, so we have a worried Henry VIII hiding out outside Oxford and in other locations throughout much of 1517 to 18. But while all of this is going on, he's also trying out a new approach and asking for a solution to his problems, which comes in the form of plague ordinances or regulations in 1517. So first of all, where are these documents from? Well, I found them in the archives at St George's College in Windsor within Denton's Black Book, which is a codex compiled by Canon James Denton in 1517 and named after its black cover. The Black Book's intended to be a collection of the college's liberties, privileges, grants of land, and meant to provide a central reference point to the chapter, but it also contains a couple of miscellaneous letters from the Kings of England to the college, amongst which we find the first known set of ordinances which use quarantine in England. So the 2 letters are, the first is a letter from Henry VIII to the St George's regarding outbreaks of plague within the castle, dated 26 September, and the second is the college's response, which gives specific ordinances to counter this spread, and that's dated the 1st of November. So, more generally, what is quarantine at this time? What is it we're talking about here? Well, it comes from the Italian quarantena, which, and at its most basic, it means the isolation of individuals or locations to prevent the spread of disease. So the Italian phrase means 40 days, or it's 40 essentially, so it's a 40-day isolation of individuals. Now, the earliest quarantine measures have been put in place in Croatia and in some of the Italian city-states as early as the 14th century in response to plague, but these ideas were slow to move north. And it's worth noting this is partly about the spread of medical knowledge and ideas, but it's also the fact that different measures work best in different places and with different systems of government. So what works in an Italian city-state doesn't necessarily work in a kingdom such as England or France. And even in Italy, there's not really a consensus about the best measures to take. They vary a bit from place to place. And it's also worth bearing in mind, we're not talking about a full lockdown of everyone necessarily. It's rather the isolation of infected people and places, and at a secondary level, the ceasing of mercantile activities, the ceasing of individuals coming into, say, a town or a city. So it's that kind of defence rather than locking down an entire population of England, for example. So here's the first of these documents, Henry VIII's letter to St George's. I'm just going to read out a slightly modernised version of this for you. Trusty and beloved, we greet you well, and where we understand that our castle of Windsor is now greatly infected with this contagious plague, the occasion whereof it is supposed not only by the recourse of beggars and other infect person into our college there, but also throughout the conversation of the inhabitants within our said castle with infected persons, and in using the clothes of persons visited with the said infection, to wherein they have lain to our no little miscontention in this behalf. Wherefore we intending, God willing, to remedy the said occasions of infection, will and straitly charge you to see the speedy reformation thereof, by such politic ordinances and provisions as ye by your great discreet wisdoms shall think most convenient, commanding straitly all inhabitants within our said castle, in our name, to conform themselves sembly to us as they tender or pleasure, given under our signet at our manor of Greenwich the 26th day of September. Okay, so we've got 3 clear points here which the college has to remedy. 1, the college has become infested with contagious plague. It's uncertain whether this relates to traditional plague or a different disease such as a sweating sickness. 2, beggars are partly to blame for the spread of the plague. And 3, the other inhabitants of the castle have also helped the disease to spread through their interactions with infected persons and to the sharing of infected clothes. And it's worth bearing in mind here that while Henry is trying to hide out at Windsor, that the castle is kind of almost being infiltrated by those going to St George's, because at this point it's quite a popular site for pilgrimage. They've got Henry VI's body there. They've got part of St George's skull set in gold. They've got a local, not quite a saint, but a local kind of cult figure. It's buried there. And those individuals are coming then into the castle to visit St George's College and potentially bringing in infection. So that's the kind of barrier that Henry VIII is wanting to stop here, and to control that influx of people into his safe castle. The college's ordinances made specific provisions to combat the spread of contagious disease. Strangers were to be sought out in times of plague and were not to lodge in the college, and this was particularly important if such a stranger was from London, where the plague occurred frequently. Now, this isolationist policy was clearly intended to limit the recourse of beggars into the castle, as well as avoiding excess interactions with strangers, a sensible policy if someone had arrived from a plague-ridden town. It is, however, the provisions which were made for the quarantine of infected individuals which are particularly of interest at the moment. Any castle inhabitant who became infected was to be quarantined immediately, along with anyone else from the same house, and the door of the house was to be shut up, limiting access. Access into and out of these quarantined houses was strictly limited. One person only was permitted to leave the house to fetch food, drink, and other necessities for the other quarantined individuals. They were required to carry a 4-foot-long white rod upright while out of quarantine, so that other members of the castle community could maintain their distance and avoid the possibility of infection. So it's a form of Tudor social distancing by carrying these large poles. It's uncertain how an individual was meant to buy or receive the meat and drink without human interaction, as this isn't stated, and I think we can discount supermarket delivery vans. Presumably these were left out for collection or delivered to properties, and that's what had happened in the continent before this. A further pole, this time of 8 foot or over, was to be fastened from the side of the quarantined house, with a wisp of hay or straw on the end, to warn the castle community of the infected house, and allowing them to maintain their distance. And these were to continue for 40 days after the last sign of infection, so that the threat of further infection had passed. And these measures would become the basis for quarantine ordinances replicated across England, although they were adapted slightly in each location. In London, for example, Thomas Wolsey produced ordinances in January 1518, probably in an attempt to lure the king back to London. And these are very similar to what they use at Windsor. So again, you have these 4-foot long white rods while travelling outside of quarantine, but they're less explicit about ordering people to remain indoors, probably realising that's a lot less manageable in a large city. And both accounts also mention the use of a long pole to be fastened to the side of the quarantined house, but in London they use a longer pole, 10 foot rather than 8, which must extend 7 foot into the street, and it must also have a bundle of straw at the end rather than just a wisp. So who was the agency behind the introduction of these new measures into England? Well, two people at Windsor stand out in particular, who feature throughout our records here at the National Archives: James Denton and John Chamber. First figure is John Chamber, royal physician to both Henry VII and Henry VIII, and a founding member of the College of Physicians in 1518. He was the first of 6 founders named in the Charter, and became censor of the college in 1523. The position of censor was intrinsically linked with seeking out poor practice among the medical community and regulating such practice accordingly. And his medical career was on the rise at the time of the Windsor ordinances. He would receive further medical degrees at Oxford in 1531 and would later be present at the foundation of the Barber Surgeons Guild in 1541, depicted when the guild received its royal charter in a portrait by Holbein as shown here. And he served as president of the Guild's incorporation, in which capacity he is associated with the incorporation of surgery in England. Now, he was a man entrenched in the medical knowledge of the time, with experience of continental medical traditions, a significant presence at court, and connections within the leading English medical institutions of the time. And it's highly likely that he formed part of the agency behind the Windsor Plague Injunctions, possibly with the help of his mentor Thomas Linacre, with whom he would later found the College of Physicians, or in his own right. Faced by the challenge of epidemic disease and Henry's demand for resolution, the Dean and Chapter likely consulted the leading physician within their own ranks, and a rising star of English medicine, rather than relying on outside help. But Chamber was not the only member of the college chapter who might have experienced plague quarantine measures firsthand. James Denton, the steward responsible for the codex in which the college's plague regulations were copied, and another prominent churchman and royal chaplain, had served in France as royal almoner to Henry VIII's sister, Queen Mary of France, during her short-lived time as queen in 1514-15. Now, I apologise for the quality of this image, but in the absence of a portrait, I thought I'd include a picture of a reference to Denton as almoner here. Now, in the late 15th and early 16th century, the royal almoner was a position closely connected with the king, or in Denton's case, the queen, and was also intertwined with concepts of death, disease, and the poor. The almoner sat by the monarch's side at dinner, distributed leftover food among the poor and needy, collected and assessed diadams from suicides, judged cases brought by the poor to the Court of Requests, and acted as a gatekeeper between the king's subjects and the royal body. The almoner was a human boundary between the masses of the populace, in particular the poor, and the royal presence, but they were also liable to transmit infection themselves. As such, royal almoners would have been very aware and alert to signs of infection, especially when this was visibly demonstrated by the carrying of a large white stick. Interestingly, the provision of white sticks to counter infection was something which had been in use in France since the turn of the 16th century, and the Windsor ordinances bear a remarkable similarity to those used in northern France, which Denton himself would have experienced while serving the king. Given these similarities between the two sets of regulations, most notably the use of white rods and hay bales as responses to epidemic disease, it seems likely that Denton may also have had a hand in the preparation of the college's regulations, using his experience in Paris as a guideline. Let's look now at some of the problems. First, let's consider how the quarantine regulations might have worked in practice, and some of the problems which might have been encountered. So for those who aren't familiar with it, this is Windsor Castle as it is today, but the overall layout is roughly the same as it would have been in 1517. On the right of the image, we have the upper ward, which is where the main royal lodgings are, and on the left we have the lower ward, which includes St George's Chapel, and which was largely under the jurisdiction of the college. At the bottom of this rectangle, we can also see the gate, which, while this particular gate was later, would have been a route into the castle and a foothold potentially for infectious disease. So here we can see a ground plan of the lower ward of the castle, with St George's Chapel in the middle, and then the various lodgings and college buildings around. Now, the use of poles of various lengths to warn the community of quarantined individuals works well on a theoretical level. So as a form of social distancing, people can see that pole and know to keep their distance from you, but it may not always work in practice. A 4-foot rod carried by an infected person provides a useful visual warning and viewed at a distance, but this effect is nullified somewhat if the infected individual walks round, for example, the corner of a building, which would block that view of the white rod and wouldn't keep that space, unless they held the sticks out so it went round the corner, but I don't think that's what's intended here. Equally, an 8-foot pole fastened from the side of the building is only useful if the community has enough space to avoid the infected house, and it also relies heavily on the honesty and diagnosis of those affected. So identifying the houses that need to be isolated and then enforcing that. In areas of the castle, such as the vicar's lodging in the open horseshoe cloister, which you can see here to the left of the chapel, that's built at the end of the 15th century in a horseshoe shape, so it's got clear lines of sight between the buildings, and an 8-foot pole here may have proved an effective measure to maintain quarantine of an individual house. In the 14th century canon's cloister, to the top right of the chapel here, as in much of London, the same measures may have been less effective. The cloister is relatively small, it's enclosed, and an 8-foot pole would have extended over much of the cloister itself. In practice, you might not actually be able to see it that well, as it was limited by the overhang of the cloister walk. And given the small size of the cloister, if one of the canon's houses had become quarantined, it would have been considerably more difficult to avoid the infected house. So instead, it's far more likely that the canons would simply have moved to other benefices at the first sign of plague, as they had done in previous decades. Practical measures aside, how were these regulations received by the public? Well, at Windsor we simply don't know, and in any case we're talking about a relatively discrete group. In London, and more obviously in Oxford, we can see problems unfolding with these new measures. In the state record, for example, we find evidence of disputes between the benefits of quarantine measures being balanced against the economic costs of such a policy and the potential for civil unrest. In Oxford in 1518, Thomas More attempted to implement the same measures that had been used in London that January. I'm just going to read out part of the letter reporting this. Please it your grace to understand that this morning Master More have certified the King's Grace from Oxford that there is 3 children dead of the sickness, and 1 sick of the same sickness, and in good hope of recovery, and how those 3 died yesterday, all 4 being in 2 households dwelling together. He have charged the Major and the Commissary in the King's name, the inhabitants of those houses that be and shall be infected, shall keep in, put out wisps, and bear white rods, according as your grace devised for Londoners. So here we have those same London regulations, which were in turn based on the Windsor regulations, being put in place in Oxford. So More's suggestion was accepted by the council, but was also made more problematic by the regular Austin Friars Fair, which was due to take place only a fortnight later. So I'm just going to carry on reading that report. The King's Grace commanded his council heads to debate this matter among themselves, amongst whom the order taken by Master More was well guided and furthermore devised, whether it should be best that the fair in the Austin Friars in Oxford, which after the old custom shall be now within 14 days, should be stopped or no, for it is thought that for the resort of people as well from London as from other infect places, Oxford shall be in as evil case by the beginning of the next term as London. Also it was said in the same council that in stopping and letting of the said fair, there should ensue grogs and murmurs among the king's subjects, especially in London, where they would think that men went about utterly to destroy them, if with other their misfortunes they should also be kept from their fairs and markets. And so after great debating, the more part was in this opinion, that the said fair should not be stopped. Notwithstanding, they concluded all to take your grace's advice in the matter. So the pros and cons of holding the market were clearly debated vigorously by the council. Was the health risk posed by merchants from London and elsewhere worse than the economic cost of cancelling the market and the complaints of powerful mercantile groups which would follow such a cancellation? Indeed, there was hostility felt in both Oxford and London to the 1518 proclamations, who felt they limited mercantile activity by the restriction of movement, and this argument clearly won the day in Oxford, with the fair allowed to go ahead as usual. The Oxford debates show some of the problems that the imposition of quarantine measures can bring, and the trade-offs which might be required for them to be effective. These measures, however, became the backbone of state regulations against the spread of plague going forwards. In time, it would become clear that neither the Windsor, London or Oxford injunctions were sufficient themselves to prevent the spread of plague. Infection continued to strike Windsor College and surrounding areas, and mobility remained the remedy of choice, remaining common right through to the Great Plague of 1665-6. For those unable to flee London, however, personal liberties were far more limited in times of crisis. Over the course of the 16th and into the 17th centuries, regulations became increasingly more stringent, both in London and also at Windsor, where a gallows was constructed to deal with those bringing goods into the town in times of infection. Such initiatives remained vital at Windsor to protect the castle and the monarch from the threat of infection at a local level, but it also provided exemplars which could be applied at a state level, merging with some of Wolsey's proactive measures for developing the Tudor state. At their core, however, there remained reactive measures, unpopular with merchants and ineffective in the long term through a lack of proper implementation. But such measures should also be considered as a key point in the history of English quarantine regulation, marking the start of a slow but steady move to state regulation, which incorporated those leading medical practices prevalent in southern Europe for over a century. So after centuries of debate and discussion, the idea of quarantine is one that's persisted to the present day, as just one tool in the state's responses to infectious disease, and one that has once again been altered to fit the present circumstances. So thank you for listening to my talk. We've now got some time for some Q&A. I should also tell you that I've written a blog to go alongside this talk, which can be found on the National Archives blog pages. And as I mentioned earlier, Oxford University Press have also kindly made the full article that this talk was based on freely accessible for you all for 3 months. So there'll be a link to this on the blog, and hopefully we can send you one shortly as well. Thank you.